So, who's left? I'll talk about cognitive behavioral therapy approaches. I'm a psychiatrist, Filiz Şükrü Gürbüz. I'm working in Beykent University. Welcome. One of the most important factors that the personality disorders focus on is that there is a psychiatric need treatment for these patients. They need a psychiatric therapy, and the quitting levels is very high from the therapy. Most of these patients cannot have access to treatment, and 70 and 80% of the patients quit the therapy. Structured psychotherapy interventions, they decrease the treatment levels in personality disorders. Evidence-based, one of the important psychotherapy interventions is cognitive behavioral therapy. Cognitive behavioral therapy actually takes into account three important concepts. We are from Mehmet Hoca's team. He uses Mahatma Gandhi's verse. Be careful about what you say. It may turn into thoughts. Pay attention to your thoughts. It may turn into the emotions. Pay attention to your emotions can transform into behaviors. Pay attention to your behaviors could turn into habits, and pay attention to your habits. They can turn into values. Pay attention to values. They can go into your character, and pay attention to your character. It may turn into your fate. So therapy works in these three things. If there is a stimuli and if there is an event, this goes into the processing of the brain, and if we drive a meaning for that, and with this meaning actually can affect our behaviors towards the emotions and the physical symptoms. I'd like to continue with the case. ML was born of a parent of a constructionist father in 1943, sixth child, very skillful at playing piano, and through adolescence, that patient started to hurt himself, putting off cigarettes in the arms, and then cutting arms with all the things. Psychiatrists recommended hospitalization in order to cut off these hurting behaviors. After hospitalization, 1 or 2 weeks, 14 to 16 sessions, ACT treatment was applied. The psychotherapy, the medications or ECT actually couldn't prevent that patient to go into the soft room, and with the willing of this patient, without being treated completely, this person is discharged. And there were suicidal opinions of the patient, and after discharge, this person started to work and took classes, evening classes in the university, and he was working in the insurance company in daytime, and then he was praying in the nights. This quote-unquote this peaceful period continued 1 year. However, this bad feelings came back. However, this he was coping without hurting himself or cutting himself. So he actually quitted this behaviors of cutting himself or hurting himself. What changed with the own expression of the verse? This change actually started with the acceptance, absolute acceptance. So this is what happened, which is put forward by the behavioralism. The people can learn new behaviors and change their underlying emotions and thoughts. Even if there is their destructive ideas, he stopped cutting himself, hurting himself, and after this happened, his opinions and feelings started to change. And started study psychology, and he started to work with he started to work as a psychotherapist. And then what he realized that the reason why the people personality disorder people stayed in the therapy was that there is an absolute acceptance. This is Marshall Linehan. There is behavioral therapies, and there were some meditation techniques. He synthesized all this. Marshall Linehan, we know the dialectic behavioral therapy is the famous model, and now it attracted more attention from the academicians. Many studies have been conducted on this, for the especially for the borderline personality disorder. This is the first line BDT methods, and then still Marshall Linehan is still a professor in psychology department of Washington University. We talked about the personality disorder psychotherapy, cognitive behavioral therapy. Now I'll talk about the dialectic behavioral therapy. What is that dialectic? Dialectic comes from the discussion or talking. It has the root, and Kant and Hegel, the philosophers, in controversies, they started to use the concept of dialectic, and the glass is either not full and not empty. It is both empty and full. So especially for the borderline patients, they polarized thought. Therefore, the negative feeling, it decreases the destructive behaviors. There are four categories in dialectic behavioral therapy. First one is the behavioral uncontrollism, and second, severe emotional pain. Third, low-grade excess one disorders, and also the feeling of emptiness and meaningless. And in the first phase, there is some behaviors threatening life, and there are behavioral uncontrolled behaviors. In the first stage, there is the behavioral modulation is addressed, and the behavioral change is addressed. First one, the decreasing of the life-threatening behaviors and hurting behaviors, and the decreasing of the treatment deteriorating behaviors, and also there is an decreasing of life deteriorating behaviors are decreased. We are dealing with behaviors more in the second stage, when the patients have absolute control of their disruptive behaviors. They still experience intensive emotional pain, and in this stage the emotional functionality is tried to be improved. Some patients could be in the first stage and could be in the second stage, and as the therapy increases, we can actually, our objective is to take them to fourth stage. In the second stage, we work with the intensive pain. And after, in order to make patients gain these skills, there is exposure to negative feelings, feeling processing, experiencing, and such sessions for having these experiences are conducted. In the third stage, there isn't any problem in the normal course of the life. There could be depression, anxiety, or eating disorders, which are the excess one diagnosis, and routine cognitive behavioral therapy or interpersonal treatment protocols can be applied.
And in stage 4, they do have the functional life, And those in this state, depending on the previous traumas or not, in their existing life, they do have the emptiness feeling and they find the life meaningless. And here is the purpose to foster the consciousness level of himself and environment. And at stage 4, we are trying to decrease that empty feeling. Mindfulness is being used in that regard. Mindfulness means that the person is focusing on what's happening to himself and his vicinity without any judgment. It's a kind of yoga. And focusing on the moment, it is all about the acceptance and the emotions and also the ideas from the mind. It's asked to be observed by the patient. And the modules at this level can be treated by the personal therapy with the consultation team meetings. And in the personal therapy, 50 to 60 minutes meetings once a week. And the main purpose is to protect the treatment motivation of the patient. And in the meeting, we see BDT meeting. We are looking at the week, we are examining the previous week, and then the agenda of the interview is being prepared. And new homework is defined. Then the summary and the feedback of the patient are being taken, and in role playing and also appreciation of the positive behaviors, the positive reinforcement, and also the reaction prevention exercises can be done, and the skill training is being done in the group format. While the patient continues the personal therapy, they continue with the skill therapy. In a classroom, the therapist explains that week's agenda, the tolerance to the problems, emotional regulation, interpersonal relations. These are different modules, and this is being done for 6 months. In the first 6 months, the modules are being completed, and in the second 6 months, that's the repetition of the previous 6 months. Phone calls are sine qua non in the dialectical behavioral therapy. And when there is a problem in the practice of the learned information during the interviews, if a crisis is going to happen, the patient can get help from the therapists, and this phone calls should be as short as 10 minutes, and the personal borders of the therapist have to be protected. You know, it is a kind of risk evaluation. And also the consultation team meetings, 1 to 2 hours meetings a week, and this team comes together. As you can guess, the psychotherapies of the personality disorders are quite difficult, and the therapist can end up consuming himself, and for this person, the team members are validating and motivating the therapist. To sum up, personality disorders are quite common. If not appropriate interventions are not being done, the high level of drop is seen. And this is an important psychotherapy model. And dialectic behavioral therapy is the third wave, BDT, one of the third wave BDT models, and dialectical behavioral therapy is quite useful, especially in the borderline personality disorder. There are 4 stages: the behavioral uncontrolled, the pain, emotional pain, severe emotional pain, low grade access, and also the emptiness and doesn't have any meaning. And personal therapy, consultation, and the other meetings are being also done.